Hey everyone, it's your channel, and let's face it, getting older is a privilege, but it comes with its own set of challenges. As we age, our bodies go through many changes. While some symptoms might seem minor, they could be signaling something more serious. That's why today we're going to talk about 8 often overlooked symptoms that you should never ignore, especially after the age of 70. We'll dive into what these symptoms could mean and why it's so important to bring them up with your doctor. Remember, I'm here to give you practical advice to help you live your healthiest life, no matter your age. So let's get started. Let's talk about fatigue. We all feel tired from time to time, right? But if you're constantly feeling drained, even after a good night's sleep, it's time to pay attention. Look, I get it. You might think it's just a normal part of aging, but persistent fatigue can be a sign of something more serious going on beneath the surface. We could be talking about conditions like anemia, where your body isn't producing enough red blood cells to carry oxygen throughout your body, or it could be your heart working harder than it should, a condition we call heart failure. Other possibilities include thyroid issues, diabetes, even depression. The bottom line is, don't just chalk it up to getting older. If you're feeling unusually tired for an extended period, don't hesitate to schedule a visit with your doctor. They can run some tests to pinpoint the root cause and get you back to feeling energized and ready to take on the day. Okay, I know what you might be thinking. Weight loss, isn't that a good thing? Well, it depends. While gradual weight changes are normal, a sudden, unexplained drop in pounds can be a red flag. We're talking about losing 5% or more of your body weight within 6 to 12 months without any major changes to your diet or exercise routine. This could be a sign of several underlying health issues that need to be addressed. One possibility is an overactive thyroid, also known as hyperthyroidism, which can rev up your metabolism and lead to unintended weight loss. Another concern is cancer, as certain types can cause your body to burn calories at a faster rate. Other potential culprits include digestive problems that interfere with nutrient absorption, like celiac disease or Crohn's disease, and let's not forget about depression, which can sometimes manifest as a loss of appetite and subsequent weight loss. So if you notice the numbers on the scale dropping significantly without any explanation, don't hesitate to reach out to your doctor. We've all had a cough that just wouldn't quit. But when that cough lingers for weeks, especially if it's accompanied by other symptoms like shortness of breath or coughing up blood, it's crucial to take it seriously. Now, I know it's easy to dismiss a persistent cough as a stubborn cold or maybe allergies. However, it's important to remember that a chronic cough can sometimes be a warning sign of a more serious underlying condition. One possibility is lung disease, such as chronic obstructive pulmonary disease, COPD, which affects your airways and makes it difficult to breathe. Another potential culprit is heart failure, where your heart can't pump blood efficiently, leading to fluid buildup in your lungs and that nagging cough. Other possibilities include infections like pneumonia or bronchitis, gastroesophageal reflux disease, GERD, or even lung cancer in some cases. The key takeaway here is to never ignore a persistent cough. If you've been dealing with one for more than a few weeks, especially if it's accompanied by other symptoms, make an appointment with your doctor to get it checked out. Let's talk about something we don't always discuss openly: frequent urination, especially at night. Now, it's normal to need to use the restroom more often as we age, but if you find yourself constantly running to the bathroom, disrupting your sleep and impacting your daily life, it's time to address it. One of the most common culprits behind frequent urination is diabetes. When your blood sugar levels are high, your body tries to flush out the excess sugar through your urine, leading to increased bathroom trips. For men, an enlarged prostate, also known as benign prostatic hyperplasia, BPH, can also press on the bladder and cause frequent urination. Other possibilities include urinary tract infections, UTIs, which are more common as we age, and certain medications that can have increased urination as a side effect. The important thing is to talk to your doctor if you're concerned about frequent urination. They can determine the underlying cause and recommend the appropriate treatment or management strategies to help you find relief. We've all had those moments, forgetting where we put our keys or blanking on a familiar name. It's a normal part of life. But when memory lapses become more frequent or start to interfere with your daily activities, it's essential to seek medical advice. While age-related memory changes are common, more significant memory problems could be a sign of a condition known as mild cognitive impairment, MCI, or even dementia, such as Alzheimer's disease. Now, it's important to remember that not everyone with MCI develops dementia, but it's still crucial to address these changes early on. Early detection and intervention can make a significant difference in managing symptoms and potentially slowing down cognitive decline. So what should you be on the lookout for? Besides frequent forgetfulness, pay attention to difficulties with language, problem-solving, or decision-making. If you or your loved ones notice these changes, don't hesitate to reach out to your healthcare provider for a comprehensive evaluation. Our eyesight is precious, and as we age, it's normal to experience some age-related changes in vision. But if you notice any sudden or significant changes in your ability to see, it's crucial to get your eyes checked right away. One common age-related eye condition is cataracts, which cause clouding of the natural lens in your eye, leading to blurry vision. Another concern is glaucoma, a condition that damages the optic nerve, which connects your eye to your brain and can lead to peripheral vision loss. Other potential causes of vision changes include age-related macular degeneration, which affects central vision, and diabetic retinopathy, a complication of diabetes that can damage blood vessels in the retina. The key takeaway here is that early detection and treatment are crucial for preserving your vision. Don't wait for symptoms to worsen before seeking help. Make regular eye exams a priority, especially after the age of 60, to catch any potential problems early on. We all get out of breath from time to time, especially after climbing a flight of stairs or exercising, but if you find yourself struggling to catch your breath even during everyday activities, it's essential to take it seriously. Shortness of breath, also known as dyspnea, can be a symptom of several underlying health conditions, some of which can be serious. One possibility is heart disease, where your heart isn't pumping blood efficiently, leading to fluid buildup in your lungs and making it harder to breathe. Another potential culprit is lung disease, such as chronic obstructive pulmonary disease or pneumonia, which affect your airways and make it difficult to get enough air. Other possibilities include anemia, where your blood isn't carrying enough oxygen throughout your body, and pulmonary embolism, a blockage in an artery in your lungs. If you experience sudden or severe shortness of breath, especially if it's accompanied by chest pain, dizziness, or confusion, call 911 or seek immediate medical attention. Pain is your body's way of telling you something's not quite right. While some aches and pains are a normal part of aging, persistent or unexplained pain should never be ignored. It's important to remember that pain can be a symptom of a wide range of conditions, some of which can be serious. For example, unexplained pain in your chest, back, or jaw could be a sign of a heart attack, while persistent abdominal pain could indicate a digestive issue like pancreatitis or even cancer. Unexplained pain in your bones or joints could be a sign of arthritis, osteoporosis, or even bone cancer. And persistent headaches could be a sign of high blood pressure, a brain tumor, or other neurological conditions. The bottom line is, if you're experiencing unexplained pain that lasts for more than a few days or is severe, don't try to tough it out. Make an appointment with your doctor to get it checked out. Early diagnosis and treatment can make a world of difference in managing your pain and addressing any underlying health issues. So there you have it. 8 often overlooked symptoms that you should never ignore, especially after the age of 70. Remember, it's always better to be safe and consult with your healthcare provider if you notice any of these symptoms. Early detection can make a significant difference in treatment and outcomes. Don't hesitate to speak up and advocate for your health. Your health is your most valuable asset, so take care of it. Thanks for watching, and remember to stay informed, stay healthy, and stay proactive. Stay